Booming.
Well, all right, we've been waiting for this story all morning, and here it is. A new way to shed excess fat without the traditional liposuction could soon be coming to the United States. Now, tests of a non-invasive procedure, no cutting, no needles, no incisions, nothing, that uses ultrasound to break down fat. This thing is coming to a store near you at some point. Dr. Jennifer Walden is a plastic surgeon at Lenox Hill Hospital. She joins us live from our New York City newsroom. Good morning, doctor. All right, so I heard about this and I was like, oh, I heard of this. This is that smart lipo that's, you know, a laser and it's not as invasive. It's not that.
It's not.
It's no incisions whatsoever. Tell us how this thing works.
Right, and I rarely say this, but this is the real deal. This is going to be the next best thing since sliced bread and cosmetic procedures. It's an external ultrasound that requires no incisions, no recovery, that melts fat, and the body normally metabolizes it just as it would a fatty meal, and you get skinnier.
How many times do you have to go to get the desired results?
Well, optimally 3 to 4 treatments spaced 3 weeks apart will produce about 2 to 3 inches of loss in the circumference or in your waistline. And these are peer-reviewed.
Welcome back. Sometimes even the best-fitting bras, pants, and accessories can't hide those trouble spots on our body. So instead of camouflaging them, just get rid of them. A new technology means you can do it without surgery or exercise. Dr. Robin Owen from Shapes Body Contouring is here to explain this all to us, and he's also here with some folks who have tried it out. So hi there.
Good morning. Great to be with you.
Okay, the exciting thing is this is the only one of its kind in the country. What is this?
Yeah, this is a new treatment. It's actually an Israeli invention. It's called the Bella Contour, and it's completely non-invasive. So there's no surgery involved with this, no injections, no oral medication, and most importantly, no pain involved with
Okay,
that.
when we hear that, we think no pain, no gain. So are y'all thinking, okay, how does it do this, right? Okay, so how does it do this?
Primarily what the device uses ultrasound to break down fat. At the same time, the treatment gets rid of cellulite, reduces stretch marks, and it tightens the skin at the same time. But the added benefit is that in getting rid of the fat, you get a huge circumference reduction. We treat 3 main areas. We do the buttock and thighs. Separately, we do the abdomen. And then you can have the upper arm onto the side of the body. And coming soon to a store near you, i.e. our clinic, will be a facial probe as well.
Oh, so I like that bra fat stuff and everything, right?
Exactly.
Get rid of it. All right, take it away. All right, so we have Kathy. And Kathy, why did you decide to do this? And this, by the way, any age, right?
Yes, yeah. Across, and that's why, and I'm very grateful for the 3 ladies to come on this morning, but we have a cross spectrum of age groups, and they'll each let you know.
Yeah, and Kathy, what was your reason for doing this?
At age 60, and under doctor's advice, weight loss had become a challenge. I couldn't lose the weight. I exercised, I went to the gym, I dieted, and the weight would not come off for several years. I went to Bella Contour, I took 10 treatments, then I waited 6 weeks and I took 5 more with results each time. It was just amazing. I could see the weight coming off. They were relaxing, painless, and fun. And I had great results.
Yeah, and when she said she saw the weight coming off, you don't necessarily say weight as much as inches, but it really turns into weight.
Yeah, exactly. It's just generally, if we go for diet and exercise, and there's a couple of things just briefly to say about that. One, it's going to take, in general, 4 to 6 weeks to truly mobilize your fat. But secondly, your body picks where that fat's going to go from. We call ourselves body contouring because we talk to the patient, find out which area matters most to those, and we're going to help your body focus on that area by kind of cheating the body by mobilizing it.
Because exercise, you're right, you can't spot reduce through exercise. This way you can spot reduce. All right, Kelly, what was your situation, and what did you see in terms of results?
Well, I was working out with a personal trainer, seeing everything from here and then up, and just kind of everything was going to the middle, and I couldn't get it to go anywhere. And so met Dr. Owen and did the treatments and lost inches. Like from here to here, 7 to 8 inches.
Right where you wanted to, and so
yes.
7, that's a lot.
Yes.
And did you see yourself change in like dress size?
Yes, I could tell the difference in the way my clothes were fitting, and what you were talking about, like back here.
Yeah.
That's where I had like the most visible results, and so that was the most exciting. So I could watch my bra smaller, and it wouldn't have the you know,
the little jelly roll back there.
One. Yeah, that's it exactly.
That little roll. Did you think this was going to work when you first started it?
I was kind of skeptical, but I was like, it's non-invasive. I have a fear of needles and anything that has to do with cutting and whatnot, and I was like, I'll give it a try. And I'd seen Dr. Owen had shown me the results from other patients, and I was like, you know what? If they can do it, I can do it.
All right, and Charlie?
I had a child, so I just needed to kind of tighten everything up, and that's exactly what it did. It really, my abs, everything was just tighter. I just felt tight again, because after a child, it's just...
You're right. I mean, in some cases, you're not necessarily overweight or fat, but it's just loose, and you're trying to get it to tone back up, so you had a different reason for doing it. She had mentioned that each time that she went, she saw results. Do you have a cutoff point? Because I'm going to keep coming.
No.
Okay. I'm just going to keep coming.
And because, you know, particularly ladies, even when we get a significant reduction with them, you still find somewhere else you're not happy about. Let's be honest about this. And so it's like, okay, I really like how my abdomen looks, but now I'd like to work on this area as well.
And how long does it last?
Pretty much indefinitely. I think each of the ladies can attest to that. I mean, this is not a cure-all in that if you continue to eat more than your body really needs, your body's not going to somehow fritter away that energy. But what we see this as is a real jump start. When I was saying 4 to 6 weeks with diet and exercise, most of us give up after 2 to 3. Imagine if after a couple of weeks you're already seeing results, it becomes more potentiating for you. And I think everyone found that, you know, for example, Kathy, you said that, hey, I'm seeing results from my exercise.
I lost an extreme amount. I lost 20 pounds.
Wow.
8 inches in 2 areas, and I went from a size 14 to 8. Wow. And it's still coming off.
Wow.
It's incredible.
Let me just say, if y'all see me shrinking, then you know what happened. As we're taking a look at a picture there, the difference in what size clothes she's wearing.
Kathy rarely lost a lot of inches. Those were size 12 or 14 jeans.
Actually, those were 14s. I went from a 14 to an 8.